We're going to be talking about single tooth dental implant. So single tooth dental implant is a great option for replacing a missing tooth. When you get an extraction done, or if you did not have a tooth in a site on the mouth, there's two options. So you can actually go to a bridge option, which is a little bit more invasive in a way because you have to grind down the adjacent tooth next to it to hold the bridge. But the good thing about it is if you cannot have a surgery due to medical condition, then a bridge can be a good option. But if that's not the case, the best option to replace a missing tooth is a single tooth implant. Now, what is a single tooth implant? So what it is when there's a missing tooth, we try to restore that area that would normally feel like your natural tooth. So an implant has three parts to it. So implant has like the implant screw and a connector that connects the implant crown to the implant body, and there's a crown that goes on top of it. So the first part of a dental implant crown would be to place the implant into the bone area. So when you're missing a tooth and you're looking at replacement options, single dental implant is the best option to consider. When you come in for a consultation, we take x-rays and we measure the tooth distance between the area that you're missing the tooth. And also we take something called a CT scan to assess and see if your bone is actually good in order to hold the implant. So the body of the implant actually goes into the bone, so we have to assess and see which angle the implant's gonna go, and if you have good bone structure, and if the surgery is even a possibility and safe. So that's when the diagnosis procedure happens, and during like the consultation visit, we'll get all the data together. And after that, we will schedule a placement of the implant visit. So typically an implant visit requires, I guess, like 2 to 3 visits, depending on like the difficulty of the site and difficulty of the situation. Now, the first visit is placement of the implant, put it into the bone, let that implant integrate into the bone, so that way it has a solid foundation to hold the connector, which is the abutment, and the implant crown. Once the implant body is fully integrated, it usually takes about 3 months, I would say 2 to 3 months, depending on the healing process, to ensure that the implant is solid and it's actually integrated into the bone. Once that happens, the clinician exposes the implant again, like the surgical site, and put a connector there and put an implant crown. Now, once the implant crown is placed there, it's permanent. It doesn't come on and off. It's just like your natural tooth. You will not feel the difference, and it's the benefit of having a dental implant is that it not only serves as your natural tooth in that area, that you can even floss, you can brush, it's not going to come off, it's consistently there, function as a natural tooth, no pain. And also it actually helps to preserve the jaw bone structure, because when you are missing tooth, it actually erodes away the bone due to Wolff's law. If you don't have pressure on that bone area, you're going to lose that bone site. So when you have a dental implant, the dental implant actually puts pressure onto the neighboring tooth when you chew, that you actually can preserve the bone that is surrounding the implant, which is a very good thing about preserving the tooth and the jaw structure. So is dental implant painful? No. I would say it's the same thing as like getting an extraction done when you're completely numb. So we're gonna be making sure that you're comfortable, you're completely numb, and we do all our back end on testing on how we're gonna position the implant, and all the information's there. So there's no like uncertainty of how this is going to work. Very predictable outcome. So if you have a missing tooth, if you want something that is best to replace that, then I would suggest getting a consultation with us for like a single tooth implant. And the care for a dental implant is very similar to what you would do to your natural teeth. You have to come in for every 6 months to make sure that you're doing a cleaning, and you brush and floss. Same thing as a natural tooth. The first 3 months, it will be a little sore. Same thing as if you were getting like a surgery on like an extraction or like a surgery on the mouth. It takes about 3 to 4 days, and like usually like 1 week to like fully recover. But we rest assured, like we always try to make sure that you're not in pain. We make sure that we give you the adequate pain medication or medication that you need. And what we would recommend as recovery method after the implant is make sure that you're rinsing that area. No drinking, no smoking, no drinking through a straw, no spitting. So that way the clotting site and the healing site can heal properly.